Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly, Senate Chamber, Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound.
Okay, thank you, members. Goramai Agav. I would like to call the meeting is now open to the public online. Fáilte Rove Lig agus Nolachana Dave. Just like to welcome you all here this morning. Wish everyone a happy Christmas, and we will proceed then with our meeting. Can I welcome members who are participating by video conferencing this morning to allow us to maintain the social distancing guidelines. And this morning that is Cara is joining us online, and Jerry Carroll online there as well. So thank you, members, and I'd like to remind all members about the protocols regarding the use of electronic devices. Thank you. We've received no apologies today, and going then, members, to matters arising. There are no matters arising today. Members, the purpose of today's meeting is the Minister is here today. The Minister and the Chief Medical Officer are both here today to brief the Committee on developments in relation to COVID-19. I refer members there to tabs 4.1 and 4.2 of your pack, which are new items of correspondence relevant to the pandemic. Can I also refer members to tab 4.3 to tab 4.10 of the pack, where there are several items of correspondence previously noted by the Committee, but which have been included for members' information today. The official report from the last meeting with the Minister is at tab 4.11. So I'd now like to welcome to our meeting Minister Robin Swan, Minister of Health, and Dr Michael McBride, Chief Medical Officer. So I'm just checking.
Computer.
Just could I ask everyone who's online, actually, if you're not speaking, to please keep your phone on mute. If you have access to headphones, that would probably be better. And if I could ask broadcasting to bring the Minister into the spotlight, and I think that's now in place. So, can you hear us there, Minister?
I can, Chair, thank you.
Yeah. Also welcome Chief Medical Officer Michael McBride. But do you want to go ahead? I'm not seeing Michael, Chief Medical Officer, name on screen here at present, Minister, but do you want to go ahead and start the briefing, and hopefully we will be joined by the Chief Medical Officer?
Certainly, Chair. I'll make, I suppose, just a brief opening statement. And I suppose this, thanks for yourself, Chair, for facilitating this meeting. I know the last meeting we had where we supplied the update on the vaccine programme, which was very relevant at that point in time. We did run out of time, so that's why I appreciate the opportunity to come back. So just as ever, again, thank you for the opportunity to update the committee.
Minister, sorry for interrupting you, Minister. It's a bit hard to hear you. I'm wondering, is there any way you can increase your volume at all? And we're also not seeing you at present. That may be just a question of video not being switched on. We have been joined now by Chief Medical Officer on screen. So it's just a wee bit hard to hear you there, Minister. If you can do anything about the volume, please.
Is that any clearer, Chair?
I think it is, yes. Yeah, go ahead.
Yeah.
Yeah.
Okay. as I was saying, you know, since our last briefing on the 3rd of December.
No, we've lost you again. We've lost you. We've lost you again there, Minister.
I'm getting feedback here, Chair.
Okay, I'm just going to pause for well, I'll actually ask broadcasting to see if they can look at that issue of feedback. It is coming through. It's not coming through as feedback into the room, but it's leaving you very, very unclear. So to be fair, we'll try to get that improved. At this point in time, we would sometimes be looking at switching off video, but obviously that's already done. Do you have access to a headset, Minister?
I have here.
Is Michael muted as well?
Pardon?
Michael muted?
And can I just check then with Chief Medical Officer that you're on mute, because I know you've recently joined and you may still be feeding through. So if you can just check, that you're on mute there, please.
Yes, I have.
He definitely noticed the last meeting that when I was coming remotely, when I wasn't on mute, it definitely was affecting other people's. Sometimes it doesn't, but sometimes it does.
Chair, just while we're paused, could I raise another issue?
No, we're still on.
Until this is finished.
We're still online. I think we'll actually pause a couple of minutes to try to get the sound quality cleared up. So we'll take a short pause.
This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound.
Okay, members, so we're resuming. We can see you on screen now, Minister, so could you maybe go ahead and try that again and see if the headphones help the situation? Thank you.
Again, thank you, Chair. I think turning off and coming back in again was maybe beneficial in this connection. No, Chair, I had him by saying, I just want to thank yourself and the committee for reconvening, because I know the last time we met when we gave an update on the vaccines, we did run out of time in regards to what we were actually given in that last briefing on the 3rd of December. As the committee will be aware, I think this is my 12th attendance since we came back on the 11th of January. But unfortunately, facing this pandemic, we still have a high rate of new cases and still sadly daily deaths. Chair, the executive, as you're well aware, took the very difficult decision on Sunday to limit Christmas bubbles to 1 day, and last week agreed to recommend tighter restrictions for a 6-week period with an even stricter 1-week period starting from Boxing Day. Chair, as I said to the ad hoc committee yesterday, none of these decisions were taken lightly. We all want to spend time with our loved ones at Christmas, particularly after the year that we've had. My executive colleagues and myself are no different. But as the Chief Scientific Advisor stated last week, if we allow this virus to proceed in an uncontrolled way, then there will be very severe consequences and further deaths. The tough decisions had to be made in order to protect life and to protect the health and social system, which cannot continue to deal with rising demand. And while increasing hospital capacity could allow us to manage an increase in the epidemic, it would inevitably have an impact on healthcare-related outbreaks and community outbreaks.
So that's why we said, if no action had been taken, our modelling had suggested over 2,500 people would need a hospital bed by the end of January. So decisive action had to be taken. And as you will be aware, phase 1 of the COVID-19 vaccination programme began a fortnight ago at Belfast RVH, where vaccinators were invited to receive their first dose of the vaccine. A mobile team from the Belfast Trust also visited a care home that day and vaccinated the residents and staff. The department, and in particular Patricia, has worked closely with MRHA to develop a deployment model that takes into account the unique characteristics of this vaccine, and that included the transport requirements and is designed to ensure the integrity and efficacy of the vaccine, and that's maintained throughout that period. This is a huge achievement and meant that Northern Ireland was leading the way across the UK by vaccinating those who had been recommended by the JCVI as the #1 priority to receive the vaccine. Chair, just to provide an update of where we are in our vaccine programme, as at close of play yesterday, 309 care homes had been vaccinated. That's over 2/3 of all homes. 7,311 care home residents have received the first vaccine dose. That's over 50% of residents, and over 8,600 care home staff have been vaccinated as well. And overall, there have been just over 20,000 vaccines administered up until the close of play yesterday, and I expect that figure to continue to grow quite rapidly. And that will do so because trusts now have their vaccination sites in operation, and substantial numbers of staff will be vaccinated in the coming days and weeks. Trusts actually plan to run these clinics up to 5 p.m. on the 24th of December, and then we'll reopen again on Sunday the 27th. Ultimately, all health and social care workers will have the opportunity to be vaccinated, which is expected to be completed within the first quarter of next year. And Chair, members will be aware that there have been a very small number of suspected adverse reactions to the vaccine. It's not unknown for vaccines to produce allergic reactions in a small number of cases. And we will continue to be guided by MHRA on the safe and effective deployment of the vaccine. And subject to the availability of a suitable vaccine from early January 2021, it is intended to roll out our programme through primary care-led vaccination clinics, which will be responsible for the vaccination of the mass majority of eligible individuals aged 50 years and over. GPs are planning to swiftly work their way down through the eligible cohorts, starting with the oldest first, and the impact of the vaccination programme should become apparent at the end of February, beginning of March. Chair, there's been a lot of discussion over the last few days about the variant strain of the virus. Further analysis and investigation is still ongoing in order to understand the characteristics and therefore the potential impact of this variant. Analysis to date suggests that the variant may be more transmissible, but it's still too early to confirm that with certainty. However, there is currently no evidence to suggest that the variant is more likely to cause serious disease. There's also currently no evidence that this strain will cause a more serious illness or that it will fail to respond to the vaccines that we are currently delivering. So I'd urge the public to act on the assumption that it's already present in Northern Ireland and that the person they pass in the street or stand next to in a queue may have it. Chair, as you have often repeated yourself, we protect ourselves from this new strain through the same methods we use to protect ourselves from the start of this pandemic. And yet again, I would remind everyone of the need to keep your distance and significantly cut our contacts with others, wear a face covering and wash your hands. And if you have symptoms, please self-isolate and get a test. And testing will be available through the Christmas period. And Chair, I'm happy to take members' questions or comments.
Okay, thank you, Minister. And I do welcome that news in relation to the administration of the vaccine. That does seem to be a fairly substantial increase in that, and that's to be welcomed. And also, I'd like to welcome the consultation on the mental health strategy that was recently launched. That's also a very welcome development, and also to acknowledge the very hard work of yourself and your leadership team and everyone involved in the health service over a very sustained period of time. And obviously we're very conscious we're heading into what could be a difficult and a challenging Christmas and beyond. So in relation to the new variant, you have indicated there that the analysis is ongoing into the potential impact. So effectively we know that there is a fire raging in terms of this new variant and the spread in parts of the southeast of England. And we also know that in a sense, given how very close our health services here have come in recent times to being overwhelmed, and we've seen car parks with ambulances and medical staff having to go out to ambulances and that. So can you, Minister, advise, and we've also seen very quick action from a number of European countries in light of the fact that this variant seems to be more transmissible, in light of the fact that it's unknown about the extent to which that might impact us, what is your assessment of the potential impact of allowing travel to continue into and further spread of this variant of the disease here? What's the likely impact of that on health services in these very critical early weeks of January?
Thanks, Chair. And again, thank you for the opportunity to, I suppose, update colleagues as to actually the discussions and the decisions that the Executive has taken. There has been, I suppose, partial coverage of discussions that were had last night due to an ongoing problem that I've often made. And that's the leaking of discussions within the Executive on papers as well. So the proposal in regards to what we've actually asked to do last night, we brought to the Executive a paper which, based on the view of where we saw the new variant in England, but also a rise in cases in the Republic of Ireland, that we felt we should immediately issue guidance advising against all but essential travel between Northern Ireland and GB and the Republic of Ireland with immediate effect. And then again, further guidance that should include asking all new arrivals to self-isolate for 10 days. And that clarity was discussed around what that actually means at the Executive further on this morning, and that further guidance will come out on those specific issues. But to be clear, Chair, why we moved to issuing guidance advising against that ban is because I think, as we were and as members were aware, we had committed to go and seek further updates from the Attorney General on what we could do and in regards to the advice that came back from her. So in parallel to issuing that guidance, what we also asked from the Executive and colleagues as well was to provide that sense of clarity as regards as to what we will classify as essential. Also that we as a department, and we've started that, would actually urgently undertake the preparatory work to form any necessary changes that we need to make to legislation actually to implement a ban on travel and the associated consideration of proportionality and human rights compliance, because that is one of the things that the Attorney General did raise in her feedback to us, was that of proportionality, of compliance in regards to EU legislation and European Court of Human Rights legislation. Also conscious of the time it would actually take to bring about a ban, a legal ban of travel. So further steps that the Executive agreed to take last night and that are being pursued now by various departments in the Executive Office is to seek that reassurance from UK government that they will robustly enforce their own Tier 4 restrictions in regards to who can travel to Northern Ireland, which will themselves curtail, actually travel across the water as well. We're also looking at, and I mentioned this yesterday at the ad hoc committee, was the use of the locator forms for travellers arriving into Northern Ireland. That would also pick up any traveller coming into Northern Ireland and then transferring through to the Republic of Ireland. And we would open and set up the measures where we can share that information. But in regards to the proportionality of the thing, the biggest challenge that we had in bringing forward an immediate action in regards to the ban on travel and stopping that meant stopping airplanes on ferry was the implications, both financial but also to our supply chains here in Northern Ireland in regards to food and medicines. So I thought it was useful, Chair, just to set out the entirety of the picture, because I do know there has been a potted version of what decisions were actually taken last night and conversations that we actually had. So we have moved in regards to what is a threat of the new variant. Of the 6,000 positive cases, and I think I said this yesterday as well, of the 6,000 positive cases over the last 14 days coming in from GB, 23 of them were from GB. So I suppose the proportionality of all our positive cases there has to be taken into consideration as well, and that was very much some of the feedback we were getting from the Attorney General was about the proportionality approach in regards to introducing an immediate travel ban. So that's why we moved to immediately issue that guidance on advising all but essential travel between here and anywhere else.
Thank you, Minister. And I do understand that there would be certainly significant consequences which would have to be dealt with in relation to a travel ban. However, most other countries in Europe appear to have weighed that risk and decided that it was essential to move quickly. And I suppose, again, linking back to that, the fact that this is raging in England, that every plane that comes here potentially is carrying sparks, which could seed further spread here. And I think I gather from what you've said there that the Attorney General has indicated that you would have and do have the power to legislate, but you're considering the impacts of that. But are you not concerned that potentially we could be closing the stable door after the horse is bolted, given the scenes we have seen in train stations and airports across various places?
Chair, there is no doubt, and according to the AG, yes, we do have the power, but it has to be taken in proportionality, and it also, in that proportionality assessment, is input from other executive colleagues and the Executive Office itself. Now, all that work, I listed, the actions that we were taking, all that work started this morning, coordinated by the new head of the Civil Service through the COVID task force. But in regards to what steps we were taking, and that's about that immediate guidance advising all against all but essential travel between Northern Ireland and GB and the Republic of Ireland, but also the 10-day isolation period, Chair, as well, to make sure if there is, and I think as you described, if there is somebody that's carrying one of those sparks, that 10-day isolation period is the same for this new variant as it is for the coronavirus that we've been fighting since earlier this year. So due to the incubation period, if any spark did arrive and people are self-isolating for that period of time, it would extinguish that spark, to follow on with your analogy.
Okay, Minister, I'm going to move on to members, because I want to give members an opportunity to get some questions in, and it's very welcome that you have given this session in order to focus in some detail on some more of the issues. So I'll go to members. I will suggest to members that if you wish to do a question and a follow-up, I'll try to allocate the time out. It's approximately 7 or 8 maybe minutes at this point in time. You can either go with a question and a follow-up, or a couple of questions. You can manage your own time in that sense. If you feel that the question is not being answered in a way that you had actually were hoping for, either indicate to me or indeed to the Minister that you want to refocus that. And if Minister and Chief Medical Officer, if I could ask you to facilitate in the sense that if one of you could lead on an answer, and then if there's an additional piece of information, significant information that one of you want to contribute, but if one of you could kind of lead on the substance of the answer, so that we get the maximum value out of our time this morning. So thank you for that, members. I'm going to go across first of all to our Deputy Chair, Pam Cameron. I'll then go to Paula, and then I have both Cara and Arlea indicating, and then Jerry indicating on the phone, and then I'll come back into the room here. So I'll start off with Pam. Go ahead, Pam.
Thank you, Chair, and thank you, Minister, and Michael McBride for your attendance here at the committee today. And just, I suppose, while I have the opportunity, I just want to say a huge thank you to both of you for what I know has been an incredibly difficult year for both of you, and also for Ian Young. And we do appreciate the massive efforts that have been put into in order to try and keep the population safe here in Northern Ireland. And I want to also extend that to actually all executive members, because we know there have been very, very difficult decisions have been taken this year. Most of them very unpopular, most of them none of us like, but we understand why that has been the case. But so I just want to put on record my thanks to you. I have a number of questions, but just very quickly wanted to ask, first of all, around shielding. Minister, you had promised yesterday that advice would be coming from Dr McBride, so I don't know if Michael wants to lead on that now and give, obviously there's over 200,000 people in Northern Ireland who were originally issued shielding letters, and those people remain very, very concerned about where they go from here and how they can be protected. And some of them have children going to school, some of them still have to go to work. And they really do need this shielding advice. So if you could give us that, first of all, that would be very welcome, and then I'll ask you some other questions.
Chair, if Michael's still on there, he could lead on that specific.
Yep.
Yep.
Go ahead, and very welcome this morning, Chief Medical Officer. Go ahead, please.
Thanks, Deputy Chair. Thank you, Pam, for your kind comments at the outset as well. Just indicates that, subject to the Minister's agreement, we'll be issuing further guidance to those clinically extremely vulnerable, previously known as shielding, later this afternoon. I would want to reassure everyone that the measures that we have put in place, the steps that you are taking, the rest of the population are taking to date, are keeping you safer. Those same measures are the same measures that will keep us all safe and you safe from this new variant of the virus. But that further information will be released and you will be advised of that later today.
Okay, and how will that information be made available?
In the timeframes, it will not be possible to send out individual letters. We will be putting that advice on the department's website, and obviously using social media and a range of other means to communicate the advice, including the NI Direct website. Thank you.
That's great. Okay, so I'm going to move on to. I wanted to ask around the workforce appeal, and ask if the number or rate of appointments, whether that has changed since the 25th of November. First of all.
I'll give an update for the workforce appeal. The new appeal itself, Palmer, the overall appeal, the new appeal went live early October. The number of new applications received as of the 16th of December was 6,891. That was 3,719 health and social care applications, and the total number of appointments to date is over 600. The appeal has also recently commenced work on recruiting for the vaccination programme, and to date, 16th of December, the appeal has generated 1,094 formal applications from healthcare professionals.
Okay, so that has gone up then since 25th of November. It has increased, those numbers have increased. Yeah. That's good, because I'm sure you would agree, Minister, that it's entirely unacceptable that there were only 6% of applicants had been appointed by that stage at 25th of November. It seems a very low figure. I'm just wondering, how did that figure compare with similar initiatives across other regions?
I wouldn't have that data to date or to hand, Pam, but we can get it for you. But just to be clear, no candidates, those who may have applied or may not be successful, might not have been offered posts for a variety of reasons, actually such as suitability or the availability of the candidates when they were offered a position actually still being available to take that up, or for example, even it was common for candidates only being able to commit to specific hours or specific days, which unfortunately didn't match the demands of the positions that were being offered. because the workforce appeal was really to, to plug some of the gaps that we saw in our workforce appeal as well.
Okay, I do understand that. I would appreciate if we could get some more detail around that and breakdowns of, where exactly those applications were heading towards, and reasons for why many of them weren't appointed, or why that didn't work. I mean, it's. I think we've talked a lot over time around contact tracing and around the need to ensure that there's sufficient capacity for contact tracing. I think that's even more vital in light of this new variant. So I would be concerned that we still don't have enough people in place, and I think we should be looking at every opportunity, and whether that's giving contracts to people who don't fit the bill in terms of which day or which hours. I think it's kind of all hands on deck at this stage. We really need everybody involved there, so I would appreciate if we could get the breakdown of that information.
Sorry, just to come in there, and I think that's where the banking staff system that we have in TTP actually works, because it allows us that greater pool to pull on when we do have that. And it's a piece of work that's already been going on. Contact tracing will be operational over the Christmas period. It's even going to be operational on Christmas Day, and one of the things we've actually been looking on and PHA have been putting in place is, should we see what we thought was going to be the expected spike, even if these measures weren't brought into place, we are scaling to a point that we'll be able to meet the demand that peak will bring.
I think that is important, Minister. And have you looked at the comparing again the Welsh model with what we're doing here, given on the back of the Spotlight, I think, I think the Spotlight did that programme, and it was very clear that the Welsh model were very good at following up, whether that was by using the technology to kind of get responses back, and then moving to humans making calls to check that people were actually self-isolating, and in fact, if there's no response, then actually going out and looking for those people to see that they are, one, okay, and two, actually doing what they're meant to be doing in terms of self-isolation and looking after themselves. Have you had any further consideration on the around the policy of how the contact tracing is working at present?
Well, I think, as we said the last time, we're always looking, about how we take the next step in contact tracing. We continue to progress the implementation of the hybrid model, the one you're referring to, and that's the focus on further digital solutions, even to deliver early messages to contacts and cases, and at the same time allowing the professional staff and the contact tracing service to do those risk assessments and deal with the more complex cases, like clusters and outbreaks as well. But we've also, and I think I've said this at a previous meeting, that enhanced contact tracing service going back 7 days, that started on the 16th of November. Our contact tracing team always looks to what works elsewhere and what has been done elsewhere. And I know the Welsh model of contact tracing has been used, and I think it was used. And I didn't see the actual TV program. But one of the things, when we compare how effective operations are, we always need to be cognizant of the results that each system is having as well, and the number of contacts that it can make and does make. Our own service between 13th and 20th of December reached 96% of contacts within 24 hours of the positive case being identified, being referred to the service, and then 98% were reached within 48 hours. So, our level of contact is above some of the other nations as well. And, when we look to some of the other comparisons in Wales, we are performing at a better level.
Okay, and just finally, I know I'm probably pushing a wee bit here. In terms of the vaccination, I really welcome the figures that you've given us today. It's very, very good news for care home residents in particular. So really very much welcome that. Could you just give us the dates again that the vaccine will be, the vaccination process is pausing for? What were the dates that it won't be happening over Christmas?
It is. We will be pausing on Christmas Eve and starting up again on the 27th. But again, we'll still be able to make sure that we're utilising full capacity over those days as well, because at that point, post the 27th, we will begin into our second phase of vaccinations as well, because we actually deployed on the 8th of December. So when we get to the 29th of December, we'll be into that second round of vaccinations with the 3 weeks being in between.
Thank you, Minister. And actually, Minister, I'd just actually take you back there to my own question, because I was thinking back over it, and I don't think really I got a clear answer in relation to what modelling you have in terms of the impact on our health service into January, given that we haven't legislated to stop that travel issue at the present time. What modelling have you in relation to the impact that may have on delivery of health services in the early weeks of January?
We haven't done any updated modelling on that, Chair, because we still need to see the transmissibility in regards to that particular strain as well, and also in regards to the immediate issue of guidance that we have advised against anybody, only essential travellers should come into Northern Ireland, and they should isolate for 10 days as well, because we also, in regards to modelling, we have to see the effectiveness of the 6-week intervention that's about to start on the 26th of December as well.
Okay, I'm going to go then to Paula. Paula, please.
Okay, thank you, Minister, and thank you, Chief Medical Officer, for being here today. Just a quick question to start off with, Minister. The recommendation around the 10 days of self-isolation that the Executive agreed to last night, is that going to be in guidance, or is that going to be written into regulations?
It will be in guidance at this point in time, because that's where the guidance is following on from essential travel. But as I said, we are developing what the legislation would look like should the Executive decide to implement a travel ban. So it will all form that, I suppose, a greater package when we get the results of all the other work streams that are being taken forward by the COVID task force.
Okay, thank you. The next question was in relation to the announcement that you were going to reimburse the nurses for their pay from the strikes this time last year. Can you confirm whether they got that additional money paid back in their December wages?
I can't confirm it, but I do know that I actually had a meeting with the Business Service Organisation and all their leads on Friday, just again to acknowledge the work that they have been doing in the background during the pandemic as well, and they were hopeful that the majority of that strike pay should be reimbursed actually in the December payroll, and if it's not in the December payroll, it will definitely be paid in January. BSO have confirmed that we did meet the deadline for processing in December, but just in the number of individuals and the number of changes that have to be made, they are hopeful it will be there in December pay packets, but if definitely not, it'll definitely be there in January.
Thank you, Minister. The next question is in relation to, we had a presentation here at Health Committee very recently there from the Northern Ireland Ambulance Service, and we were advised that there was a business case that's been put forward to your department around sort of the transformation agenda, and I think that was 30 million over 5 years. I would appreciate if you could give us an update on the sign-off of that business case.
Thanks, but that business case hasn't come to me as of yet. It's not on my desk. I'm aware of the presentation that has been made, and the detail went in there, because we know the long-term investment in the ambulance service is something that we need to take seriously in regards not just to equipment but staff as well, and the work that needs to be done to support them. So it has been submitted. It hasn't come my length yet for assessment or sign off.
Okay, and finally, Minister, you mentioned in the chamber yesterday around, in response to a question from me around the long COVID, the sort of the package of measures that's been put in place. Could you give us an update on where that is, please? Thank you.
Chair, if you don't mind, I'll ask the Chief Medical Officer to pick up on that specific.
Yeah, certainly.
Thank you, Minister, and thank you for the question. The Minister had directed that a piece of work is taken forward to develop a service specification which would deliver in keeping with the new published NICE guidance, which, as you can recall, were published last week, where it set out a set of standards in relation to those individuals who experienced a longer term or medium term effects from COVID. That is currently being considered within the department, and we'll be engaging with Commissioner colleagues in terms of developing a specification for the requisite support. Clearly, it will require multidisciplinary input across a range of specialist services, including a range of professions from other backgrounds.
Thank you. Just finally then, I just want to wish you both a happy Christmas, and I hope you're able to get some rest over the festive period. Thank you.
Thank you, Paula.
Thank you, Paula. And I'll go then across on the phone lines on video conferencing to Cara Hunter. Go ahead, Cara.
Chair, and I thank you, Minister and Michael, for being here today. I always find your briefings extremely helpful in seeking clarification. We recognise the difficult job that you have, and especially during Christmas and getting the public to adhere to regulations. I just have a few questions. One of them would be around the training of giving vaccinations. I'm mindful we have a population of 1.8 million people. So I'm just curious what steps the department has taken on this matter to ensure that we have an adequate workforce to tackle the virus through mass vaccination.
Chair, I'll let the Chief Medical Officer pick up on that, if it's okay with you.
Yeah, certainly. Go ahead, Michael.
Cara, thank you, and congratulations on your appointment to the committee, if I might be allowed to say that. We have an extensive programme of vaccinators underway. That includes the peer vaccinators, over 900 peer vaccinators within our trust, but also additional volunteer vaccinators who have all gone through an extensive online training programme. It's a 18-hour online training programme. All individuals are required to have updates in relation to CPR, dealing with anaphylactic reaction, etc. So there's extensive training and supervision and sign-off of those individuals, because you're absolutely correct, it's important that this is a new vaccine, and it's important that those vaccinating have all of the requisite skills to ensure that those vaccines can be administered safely. And in the majority of cases, we know that's uneventful, but sometimes individuals do have reactions to vaccines. So I can assure you that that is in place. We also have a series of safety checks which are put in place time a vaccine session begins, where staff go through the routine, and also a series of questions which are asked of individuals as they book a vaccine. So for instance, that we avoid individuals who may have a previous risk or high risk of anaphylactic reaction from getting the Pfizer vaccine. And then there are specific questions where the vaccinators again go through that checklist with the individuals who are presenting for vaccination.
Thank
Cara,
you very much.
I know we, sorry, Chair, maybe just to come in as well, but I had a meeting yesterday with community pharmacy, who are also mad keen to be part of our vaccination programme as well. They step forward in our flu vaccine programme, so they want to be part of the overall response, as do our GPs as well in primary care. So the more vaccine we get available, our health service, our health family are really stepping up to deliver this, and they see the benefit that it will bring.
Thank you very much. And just on that, I know the public have heard about pregnant women who receive the vaccine, that there can be that some are apprehensive, especially they've also mentioned that some young women after receiving the vaccine shouldn't conceive within 3 months. Michael, this might be a question for yourself, just around if you have any further clarity. I know the public are very curious on this matter.
Yeah, I mean, I think with any new vaccine, we're always just cautious. And the fact of the matter is we don't have any evidence of any cause for concern in pregnancy or in women who are planning pregnancy. But again, the precautionary principle applies in medicine and in health, that until we have evidence that the vaccine can be safely administered in pregnancy, we are advising all of those who are pregnant not to be vaccinated, or those who are planning pregnancy. But that is purely a precautionary measure at this time until we get further data.
Fantastic, thank you. Just 2 more questions. I'm just wondering if you foresee any changes in January with a travel limit, something similar to what we've seen in the south previously in the year, around a 5-kilometre limit. And lastly, I've been lobbied by constituents over the past 24 hours just around looking more clarity on the curfew and how that will work. Thank you.
Thanks, Cara. In regards to, and if you don't mind, I'll maybe answer the 2 questions together, because it's part of the conversation was actually had at the executive this morning in regards to the curfew between the 26th of December and 2nd of January. And there's a discussion around what regulation is needed to be brought in to make it or enable the police actually to enforce it or stop people. So that conversation again is ongoing. It's part of a follow-up from this morning's meeting that's been led again by the COVID task force under the compliance working group. So we should hopefully get an update on it as soon as possible, so that people understand their responsibilities, but also so the police know exactly what powers they bring. In regards to the curfew over that week's period, it's really about us driving home, I suppose, the seriousness of where we see this 6-week intervention and doing all that we can to make sure that it gets into people's mindset of how important this is, but also being aware of, the opportunities of between that Christmas period and over New Year's, the opportunities for house parties and things like that. So it's really about limiting the opportunity for those events that would bring more people together and more unregulated and uncontrolled venues would see further spread of the virus.
Fantastic.
Is that okay? Sorry, that.
No, that's great. That's both answered. Just to thank you both for making yourselves so readily available to us, and to have a lovely Christmas.
Thanks, Cara.
Okay, thank you. And going then, still on the video conferencing facility, if broadcasting could bring Orlia Flynn. And can you go ahead there, Orlia, please?
Yes, thank you, Chair, and thanks to the Minister and Michael. So, Minister, in your opening remarks, you had mentioned that work is underway to prepare for legislation if that is required at some point, and that work started this morning. I just wonder if you could elaborate a wee bit more on that. And you had also mentioned that when you were discussing this and taking it into consideration around the travel ban, that you were conscious of the time that it would take to bring about a ban. So I know that obviously in parts of Britain and in the south and stuff that some of their bans did come into place pretty swiftly. So is there any particular reason why it would take, it would be a longer process or maybe a more complex process for us to make that decision if it's the right thing to do? Thank you.
I suppose earlier in regards to, and I suppose it's around the utilisation of the 67 Act, it's not something we've used previously. In regards to enforcing travel, it's not something we have sitting on the shelf ready to lift down. So it is about starting that entire scope and exercise as to what regulation would actually look like. Some of the things we can move, and we are moving on hopefully swiftly, is that local guidance that we can give police, to stop people. We've seen that being utilised in the Republic of Ireland and also in Wales as well. But, in regards to the travel ban itself, now I've just received, or I'm just seeing an update here, that the EU Commission has actually said that EU countries have been told to lift their travel bans to the UK to allow essential travel, minimise trade disruption. So I suppose that actually is in lockstep with what we were recommending to the executive, where we restrict any movement coming from GB or longer term from the Republic of Ireland, that it is reflected that it is only for essential reasons to meet that. So the delay, I suppose the delay in bringing about that legislation is the fact that we don't have it on the shelf. That's why we had to seek guidance from the Attorney General of the implications that it would have, and then in regards to working with other ministerial colleagues in regards to what their commitments is, what their requirement is, or what the effect it would have on their various executive functions. And again, I'm not saying it's the reason why it takes a wee bit longer, but we are a 5-party executive. So it's not as if we're one party that the Prime Minister says this is what you go and do. So we work very much by consensus and that collaboration. So it was going to take that time, but it's work that we have started this morning within the department. And now I think that we've started it, we'll continue to do it so that we have it should we need it on a future occasion.
Okay, Minister, thank you. And you had touched on it just there yourself around the, so obviously there's concerns around the supply chains that you had mentioned that could impact on food and medicines and things like that. So, is there evidence showing that if we were to implement a ban, that because obviously that would be quite serious if you were looking at food shortages or medicine shortages? I know we've spoke about it in a different context around Brexit. But I'm just wondering, have you, any sort of stark, facts or evidence on that, because that would be obviously a worry for yourselves.
Yeah, and Orlia, that was actually part of the conversation around the executive meeting late last night. But other colleagues were asking those questions. Do you have how much? Do you know how much food? Do you know how many passengers we're talking about? And it became very evident. I think when we didn't have those answers that we could give ourselves when it came to meeting the proportionality criteria for bringing in such a travel ban under regulation, it would be hard to justify at that point. So that's why the Executive Office, again under the COVID Task Force, is away gathering that information together. Because when it comes to a travel ban, you have two options: you either ban a person or you ban the vessel. Mm-hmm. If you ban the people, the implication then is the vessel still going to run? So as an airplane, as a ferry, is it financially viable for those companies? So if we ban the individual rather than the vessel, we needed then to ensure that there was some sort of financial support mechanism to ensure that those ferry companies kept running, to bring the food, to bring the oxygen, to bring the medicine supplies. So that's why it's a part of that, I suppose, the greater executive collaboration as to how that would actually be implemented, rather than just moving straight away to do it.
Okay, and just finally, Chair, one more question just around. So, obviously with the new variant, it is going to have a massive impact on the island north and south, and I know we'll have the previous MOU in place and stuff like that, but do you think there'll be any additional proposals or measures just to try and coordinate the north-south working? Because I know you mentioned the passenger locator forms, and I know your frustration in the chamber yesterday as well, just around having issues with the data assurance. So is there any additional measures with the South? And then just finally, just to say Happy Christmas to you and Michael, we both get a very well deserved. Thank you.
Arlia, thank you. No, look, in regards to, I suppose, the working and the work that we do with our colleagues in the Republic of Ireland, there was North-South Ministerial Council on Friday, where again, and as I said yesterday, the frustration was raised about the travel locator forms. The UK health ministers, the four ministers, have a weekly meeting, to update in regards to where we all stand, any concerns that we have, or any issues that we're just facing as health ministers. I've said this before, and I'm not sure I've said it to yourselves as a committee, but it's one of the most refreshing political meetings I think that I attend. You have an Ulster Unionist health minister, a Scottish Nationalist health minister, Welsh Labour health minister, and an English Tory health minister, and there's no politics in it, because it's all about health. Now, one of the things that Matt Hancock has actually done as well is Stephen Donnelly's invited to this meeting, which is going to be tomorrow as well, and just in that's in regards to where we are, to give an update on vaccinations, because as I've said in the past, one of the things that we've actually said to our colleagues in the Republic of Ireland, and maybe Michael can follow up on this, when it comes to the deployment of the Pfizer vaccine, if there's any learnings or lessons that we have, we'll give it to them, we'll supply it to them. There's no point of us, holding back on that, because we want them to roll out as a successful vaccination programme as we are, because it makes sense across this island. So that work's ongoing. I know Michael spoke to Tony Houlihan, the Chief Medical Officer, trying to put days into weeks now. Just when you're having executive meetings at 11 and 12 o'clock at night, they're all run into. I think it was yesterday you met with Michael. Tony, Michael. Yeah.
Met with Tony and Ronan Glynn yesterday.
Just Michael, you're a bit faint. Can you give us just a brief update on a brief addition on that, Michael?
Yeah, just to say that the Tony Houlihan, his team, and my team, we meet on a weekly basis. We met again, a sort of an extraordinary meeting, which we both agreed was warranted, given the emerging situation on the new variant and the potential implications for us all. So we had a very detailed discussion about the new variant and the potential implications. But as I say, the Minister's absolutely right. We have been sharing, learning as we go throughout this pandemic, and we've made very clear that, and indeed have already shared information with colleagues in the Republic of Ireland in terms of how we got around the logistical challenges of the rollout of the Pfizer vaccine. And as I say, we'll continue to do that.
Okay. Thank you. So going then on the phone again to Jerry Carroll. Go ahead, Jerry, please.
Can you hear me okay, Chair?
Yes, Jerry, we're hearing you there. Fine, thank you.
Thanks, Chair. Yeah, first question, Minister. I understand the Neurology Cohort 2 outcomes report was finalised in October. Do we have any date for when that's going to be publicised?
Thanks, Chair. I was just trying to work out what was on your bookshelf there, but I can't see clearly, just in case there's a Christmas reading or something there. Look, in regards, sorry, apologies, and what is a serious issue. The patients and families involved, are eager to see the publication of the Cohort 2 recall, and I will advise, I expect to make a statement addressing that publication early in the new year to the Assembly.
Thanks, Minister. The books are the Left Book Club, and if you want any reading over Christmas, I'm happy to send some your way. So thanks for that answer. Just following up on a different question, Minister. I raised the issue, obviously, yesterday, and you responded around the issue of schools in the ad hoc committee in the Assembly. I am deeply concerned that yourself and the CMO essentially are warning schools not to operate on a business as usual approach, but in any real sense of looking at it, they are operating as normal, as business as usual. So I'd be very concerned about schools. I mean, how concerned are you that schools and testing centres are going to be safe come January 4th and thereafter?
I'll just separate your last 2 points there, Jerry, in regards to testing centres. And I'll repeat the answer that I gave yesterday. If anybody's using a school facility, or if a school is facilitating testing, and in regards to, I think you're talking about the transfer test, it's up to the school. And it's up to the Board of Governors, those organising the test and those delivering the test, to make sure that they meet all the current regulations in regards to bringing numbers of people together in the same location. So the onus would fall onto the organisers and those who are delivering those to make sure they comply fully with health regulations. In regards to schools, there has been a lot of guidance and updated advice being given to the Department of Education by the Chief Medical Officer, by the Chief Scientific Advisor. We published a paper of non-pharmaceutical interventions, and that was the things that can be done prior to a vaccine. We shared that with all the executive colleagues back at the end of September. We've provided updated side advice in regards to, I suppose, reducing the risk in school facilities, and I know that Michael and Ian have been engaged with departmental officials within education as to how those actually work and what those actually look like. So I don't know if Michael wants to update just in regards to the conversations that have been had at an official level.
No, other than to say that following the agreement at the executive, there has been further engagement between myself and the Chief Scientific Advisor and Department of Education officials. The advice remains that, as we've said before on many occasions, that schools do make a contribution to R. It's difficult to get R much below 0.9 with schools fully open. And the SAGE evidence paper, which was previously circulated to the executive and indeed has informed the discussions with DEE officials, includes a range of options between schools fully opened and schools fully closed, including reduced classroom sizes, alternate day teaching, a move to online teaching, etc. I think there is no doubt that the emergence of this new variant is concerning. There does seem to be no evidence to date that it's particularly prevalent in any age group or particularly target any age group, but we have seen reports of it's being present in quite a number of school-age children. And I think we just need to watch that space as to what, if any, the implications might be for a return of school opening in the new year.
Thanks for the answers. I suppose the concern, Minister, is that, there's obviously been a lot of discussion in the last few days about restrictions on households with Christmas and everything associated with it, but there's not the same level of focus or concern being raised in terms of the education ministers actions in regards to the virus spreading in schools and test centres, as you said, in relation to the transfer test. Just how does this happen in terms of you make a recommendation, presumably to the executive and to the education minister? Is the onus on him to ensure that that advice is adhered to, followed up on, or is there a vote on the executive? Just if you could give us a sense of how that happens, and obviously you may not get the time, so wish you both a good and safe Christmas and break and all that.
Thank you very much. I suppose in regards to process, we can provide advice and clarity in regards to the recommendations that are included in those papers, the SAGE paper, the MPI paper, as to what further steps can be introduced in schools. I would, the Minister of Education has the responsibility for schools and the delivery of the education programme. So we can provide advice and guidance, and we do. And then how that is implemented is through his department, through the Education Authority, and through schools. But that advice and guidance we'll always provide. I was going to say we'll be provided if we're asked for it. We provide it when we're not asked for it. We provide if there is any change in guidance that comes out from international best practice. We share that with colleagues. So it comes from the last, and I suppose you're asking there in regards to the executive. I think the last agreement the executive had, the conversation between ourselves and education would continue, and we could provide that updated clarity on any questions that education has and what certain steps actually mean or how they can be introduced, and we continue to do that and will continue to do that.
Okay. Thank you. Going then back, coming to first of all to Pat Sheehan, then going to Jonathan and then Alan. So go ahead, Pat.
Okay, first of all, Minister and Chief Medical Officer, I want to wish you Nolly Conadiv, happy Christmas and season's greetings to both of you. I'd like to have a bit of a discussion with both of you around risk assessment, particularly in terms of the recent issue around travel, but also in general terms. And first of all, I'd like to know who carries out that risk assessment. So in terms of the travel, for example, of this week, the issue this week, the virus has been running rampant in southeast England. Matt Hancock himself said the virus was out of control. Yet plane loads of people are flying in here from Heathrow and Gatwick. There are ferries crossing the Irish Sea full of people. Now, the level of compliance with the regulations and guidance in England in particular is quite low. The information we have is that only 18% of people, for example, were self-isolating when they were supposed to be. So if we extrapolate from that the level of compliance of people in the most affected areas is low as well, we can assume that a number of people were travelling from those areas to airports. So no one was asking them at the airport gate for their postcode, so they were free to move ahead. When they get on the plane, there's a risk that they're passing, if they have the virus, that they're passing it to other people. And when they arrive here, although the guidance is that they isolate for 10 days, no one is enforcing that, no one's checking up on them. They may be getting into buses, trains, taxis. They may decide, even if they're travelling onwards to the south, for example, that they'll spend a day shopping in Belfast city centre. So all of those particular parts of the process are risks in themselves. And I'd like to know, first of all, who carries out the risk assessment? And can you explain in sort of layman's terms what that risk is? If we're talking about professions that carry out risk assessment, let's say, for example, a bookie, if he has a horse at 100 to 1, there's not much chance of it winning. Whereas if it's even money, it has almost 1 in 2 chance of winning. And then you have actuaries in the insurance business who carry out risk assessment and so on. It just seems to me, given that over 40 countries imposed a travel ban with the UK, that they thought there was a significant risk and we didn't. So can you explain the divergence of thinking there?
Thanks, Pat, and happy Christmas to yourself. And in regards to that risk assessment, it's a piece of work that's brought together by I'm trying to think of the group itself as our expert advisory group that Ian and Michael are part of, that come forward with those recommendations on papers to the executive. In terms of context in Northern Ireland, and this is in the paper that we presented to the executive, associated cases of COVID-19 representative in relative terms a small percentage of overall cases. It was actually less than 1%. So, for example, the last 2 weeks of the approximate, and I used this before, 6,000 new cases, only 23 have reported travel to the rest of the United Kingdom. So while they've reported, being in the United Kingdom, it's not necessarily the area where they have contracted COVID, if you understand what I'm saying as well. So in that risk assessment, it comes about then transferring that to proportionality. I don't think there has been any difference, and it's actually something the Chief Scientific Advisor informed the executive. There's no difference in the risk assessment as far as he's aware of what is given in regards to the new variant, but it did come back then in regards to policy and how governments interacted and the decisions they were taking, as I said earlier on, in regards to what we've now seen, where the EU Commission has actually instructed other EU countries to lift the travel bans that they have introduced.
Yeah, and I understand that, and I'm not particularly interested in this conversation around the new variant, but the fact that the virus is out of control in a particular area where a large number of people are travelling from to here. And this pandemic started with one person being infected. We're now in a worldwide pandemic. So, are the odds of the virus arriving here on a plane 20 to 1, 100 to 1, 1,000 to 1? Can someone quantify what the risk is so that we can compare that with what other countries are saying?
We're not hearing you there, Minister. You seem to be on mute.
All right, sorry. And that was a very good answer, Pat. No, look, in regards to relative risk of travellers from the UK having COVID-19, and as I say, is less, and this was actually in the paper that went to the executive, is less than 1 in 100, and is significantly less than that for the new variant, and that's why we recommended that precautionary approach. So that's specific in regards to the new variant as well. And I know, I think one of the things, you did raise, and you raised it in the chamber yesterday, in regards to, people using Belfast then to travel home. Now, I've noticed the Irish government have now chartered 2 aeroplanes and a number of ferries to bring people home. So, what would have been a certain number of people stretched out over a number of commercial flights are now being curtailed into a smaller number of chartered flights. So I would have to look to Ian or Michael to see if that increases risk or not of what arrives on the island. But the decision that we took last night was on the basis of the assessment that was brought forward by CMO and CSA.
Okay, and could I just finally more a comment rather than a question? I think the decision not to impose a ban at the time, a few days ago, was the wrong decision. And I'm not sure the decision was made on public health grounds. But leaving that aside for a second, I quoted Mike Ryan to you in the chamber yesterday, and I'll quote him again today. He says, "The greatest error in this pandemic is not to move. And you should move and have no regrets, because the virus will get you if you don't move fast." And having this discussions and consultations and having a conversation with this person and that person about what to do is the wrong thing to do in this pandemic. If you're going to move, you need to move fast. We need to stop the virus in its tracks. And if we dilly-dally and dither and delay, the virus is going to come through an open door and it's going to spread. And you know as well as I do, Minister, the virus has arrived here on planes. The transmission rates are going to rise over the next days and weeks. Make no mistake about that. Jenny?
Okay.
Sorry, no, and thanks, Pat. And again, I don't think you and I are ever on very different pages in regards to this, but it's where we are and what we do over the next 6 weeks from the 26th of December. And even from today, will have a major impact and a major influence on where this virus is in Northern Ireland leading into next year until we get the full rollout of our vaccine programme. We said a couple of weeks ago, that it did provide the hope. The vaccination programme provided that hope that we need to be looked for. So I'll say it again. Let's not abuse or lose that hope.
Okay, thank you, Jonathan.
Thank you, Chair, and thank you, Minister and Chief Medical Officer, for coming to the committee today to answer these important questions. Firstly, I suppose probably we've been watching some alarming news reports in relation to hospital capacity, which have been used largely to justify some of the measures that the Executive have put in place. Minister, how worried are you of hospital capacity at present?
Very concerned, Jonathan, in regards to what we have. We've seen hospitals at over 100% capacity, which puts additional strain and stresses on not just the system, but also the people working in it.
Okay. Overall capacity yesterday was at 2,838 beds in use. 10 weeks ago, that figure was 3,680. Can the Minister please elaborate on how then, on those figures, justification is for deeper lockdowns? I'm interested to hear the thought process behind that.
Again, Jonathan, I think if you look at the bed stats, if you actually if you took them off the public dashboard, is that where you got those?
I'm reading off the department website, hospital statistics, inpatient and day case activity 2019-2020, and also the dashboard at present.
Well, if you look to the dashboard as well, under the explanation notes at the back and how they calculate the number of beds available, there was a change in calculation was made where they actually removed from that overall number those ring-fence beds that are used for cardiology and other specialities that aren't open to, I suppose, general surgery or general medicine. So what that dashboard now is looks at the availability of beds that are there for general medical purposes, and that now unfortunately includes those high number of COVID patients as well. And I suppose one thing always to be cognizant of as well, when you look to the number of the count of those beds are available due to the number of staff there are to staff them, not because of the physical bed or mattress that is available. So there's changes in how those numbers were calculated. I think by listening to the dates that they've used, there was changes in calculation as to what was actually presented on the dashboard and is available from the website to make it a more realistic approach of beds, or a more realistic picture of beds that actually are available for normal medical purposes on a day-to-day basis.
Okay. How many patients are currently occupying the Nightingale facility at Belfast City Hospital?
If you're talking about the ICU capacity, I don't have that number to hand. And again, I suppose maybe for future committees, if you are looking specific numbers, if you could provide them as an update or a prelim to us, we can have those numbers to hand, which would be useful for you.
Well,
but one of the things...
Sorry, Minister, I understand if you don't have that figure, maybe you better answer the question, or be better placed to answer the question. Has it ever come close to delivering the additional 75 critical care beds, which was committed to in the surge planning framework?
No, because we didn't need to, because one of the things about the surge planning for the Nightingale ICU capacity was when we reached the number of patients across Northern Ireland that needed ICU support due to COVID, we would operate and would increase the number of floors that are available on the tower block step by step. We had to do that, and the only way we could do that under the surge plan is actually redeploying all our ICU nurses and anaesthetists from across the entirety of our health service in Northern Ireland. So it is a surge plan. There's for worst case and challenging situations where we can see those ICU bed capacities that are available in our local hospitals no longer being able to cope.
Okay, and suppose probably as I'm listening to this and understand that, you know, there is bed space available in that context, it is indeed worrying that there were on average 5,779 inpatient and daycare beds available across trusts in 2019-2020, yet yesterday the total bed count on the dashboard was less than half of that. And I understand, because the Minister is constantly on record as saying this, and I do get this point, that you're on record as saying that, you know, you can build space, but you can't immediately buy or build those medical practitioners, which leads me on to the point in relation to the workforce appeal. And I know that number has increased since the last update of the 25th of November, as to over 600 people now that have been recruited. But I suppose that is still worrying, given that there was over 6,000 applicants. And I think particularly around the case of, so total appointments as of 25th of November for nursing, for example, was 27 out of a total of 199. And medical, there was a total applicants of 39, but only one recruited. I suppose probably this is leading to a lot of concerns as to why the workforce appeal and those people that are potentially could be put to good use have not been used.
And I think answering part of the question earlier on to Pam, it's always about making sure that those people who do apply actually fit the criteria and meet the specification that we need to actually fill. So it's about matching applications of workforce appeal against actually the capacity and the gaps that we need to fill. We had candidates who were actually seeking permanent employment and came through the workforce appeal as well, so they were able to be redirected. The idea of the workforce appeal was about securing that temporary employment and an offer to actually to support trusts through the pandemic. And look, let's be, I know you have the numbers because I gave you they're there as written answers to questions that you've tabled, and all those appointments have played a vital role in assisting the health services. But as I said, candidates may not have been successful in being offered a post or being appointed for a variety of reasons, and that would be suitability and availability of the candidates. And as I said, they may not always match the requirements of the role being offered. And it was common for candidates for only being able to commit for specific hours or specific days, which actually didn't match the demands of the positions that we needed to fill.
Okay, and finally, Minister, I suppose probably I've tried to elaborate on a lot of my points in relation to capacity, of which I do have concerns as to how that is reported, given, as you've mentioned, there is maybe some ambiguity around some of the figures and how they're interpreted. But I'm going back in time to the beginning of the pandemic and the lockdown measures that were put in place with an attempt to build capacity in the health service. So was the department wrong to focus on procuring additional equipment and building Nightingale hospitals if they knew from the outset that there was a real potential that there wouldn't be enough staff to deliver the extra capacity? And was that a strategic error at that time?
Sorry, and I suppose, Johnny, one of the things about being able to manage a pandemic through hindsight was not a gift that we were given. So one of the things we did at the start in regards, and I remember sitting in front of this committee as well, where the focus was on how many ventilators we had, how many ventilators we were buying, and in the meantime we were training staff to be able to utilise those ventilators. What we did not know back in February and March was how this virus was actually going to manifest itself, how many people were going to have to support through your hospital system or even see coming into ICU. Because you have to put things into context. Back at that point in time, we were looking across the globe. We were seeing hospitals in Italy where there were people lying on corridors, unable to be treated, unable to be supported. And if we were sitting here today having seen those same situations, having occurred in Northern Ireland, I don't think I'd have been sitting here as Minister. But what we did was took the appropriate strategic direction and decision to make sure that we had a health service that was going to be able to cope with what could have been the worst of worst scenarios. But due to the compliance and the interaction and the support of the people of Northern Ireland that we saw during that first lockdown, we did not get into the situation where many other parts of the world actually did. And I suppose the most important point is that we get back to that same level of compliance in this next six-week period, so we don't see those further pressures come on our health service. Because one of the things that we've done differently in this wave compared to the first wave, and is trying to keep as many of our elective procedures going as is physically possible. It's pushing our system to a strain, it's pushing our staff to the strain. That's why we're seeing capacity levels of over 100%, is because we're doing so many of those routine procedures. Whereas during the first wave, when we did not know what was happening, we suspended a lot of those. We redeployed staff, we trained staff to make sure that when those high number of cases that could potentially have hit us, we would have been prepared for them. But thankfully, we didn't get to that situation.
Okay, thank you, Minister. And I think you'll be aware that it's imperative upon me as a member of the Health Committee to scrutinise the decisions that were taken. And I thank you and the Chief Medical Officer for your time, and wish you both a safe Christmas.
Thanks,
you.
Johnny. Thank you, Jonathan. And
thank you, Minister. Just at the commencement, I'd like to place on record just the reassurance that has been given by yourself earlier about the successful to-date rollout of the vaccine programme. Minister, I was going to ask you a question around the importance of maintaining the supply chain into Northern Ireland in the event of any travel ban, but Orla had already sort of asked you about that, and you have stated just how important it is. Can I just maybe ask, is it a given that the rest of the executive are unanimous around the importance of maintaining those supply chains? Another question would be then, do the tier travel restrictions in place in Great Britain offer a degree of mitigation against current travel arrangements facilitating the transmission of the virus into Northern Ireland? And another question on travel, did the unexpected imposition by the Republic of Ireland of the 48-hour ban on travel between GB and the Republic carry the potential of creating an additional risk to residents of Northern Ireland, given the influx of travellers to the Republic of Ireland forced to use our ports and airports to try and get home? And is the proposed state airlifting of Republic of Ireland citizens home not really defeating the purpose of their original travel ban, and in fact it's maybe in some sense making a nonsense of it? And is the Minister aware of any geo-tracking or other tactics being deployed in the Republic of Ireland to identify the existence of the new variant in the Republic? And Jonathan had asked you a question, Minister, around the Nightingale hospital beds in the City Hospital. Can I just put on record that I thank God that we haven't had to fill those beds, and indeed it is reassuring that they are there if we do need them. And in conclusion, Minister, Pat did mention earlier about a risk assessment, and I'm just wondering who did the risk assessment for Sinn Féin back in June. I'd be interested to see that document.
Minister.
I don't think the last question, Alan, is either for me or Michael. In regards to supply chains, just going through your questions in order, yes, we have a concern about our supply chains in regards to anything that would stop either the movement of ferries or aeroplanes, because we are reliant. We're at the end of a very long supply chain when it comes to some medicines and some medical devices. There's a lot of work has already been done preparing for that due to Brexit. So a lot of those contingencies are in place. I met one day last week. I was down with one of our major pharmaceutical suppliers into Northern Ireland with the Chief Pharmaceutical Officer in regards to what steps have been taken in regards to ensuring the supply of our medicines and medical devices. Post the 1st of January. Part of the concerns that were raised were that those smaller suppliers, those smaller manufacturers may not have been already signed up to the Trader Support Scheme. So we were able to raise that at our departmental level with the DHSC to make sure any of the smaller suppliers across in GB were aware that they had an implication to do that. So there's a concern around supply chain, but there's a lot of work has been done to ensure that we do have that continued supply. In regards to the GB levels and the tiering processes, the Tier 4 restrictions do within themselves tell people not to leave home. Tiers 1 to 3 tell people to stay local. So my reading of any of that would be that neither local or staying at home does not involve getting on an aeroplane to come to Northern Ireland. So that's why we've put in, and again, that guidance as well for all but essential travel. And as I said earlier, one of the things one of the asks that the executive agreed, and one of the pieces of work that has been taken forward is to seek that assurance from HMG about how they are enforcing their Tier 4 restrictions and how that will in itself curtail travel to Northern Ireland. In regards to the announcement by the Republic of Ireland in regards to the 48-hour travel ban, which and I think I've said this in a couple of answers, I now see the EU suggesting that they should actually lift. Now, from what I am aware by speaking to other ministerial colleagues, we didn't have any pre-sight of that. I think FM and DFM, like myself, received a call after it had been announced. So it left us as the funnel or as the avenue again back in. But if there had been more coordination and, I suppose, conversations, it could have made a difference. In regards to what we're now seeing with the Irish government, chartering planes and chartering ferries, they're bringing back the same people that would have been coming on those commercial flights over the past 48 hours. So I struggle to see. I suppose I struggle to see now the benefit in that ban if you're bringing back the same people from the same area, but actually putting them into a smaller, compact number of aeroplanes and ferries as well, where they will interact. In regards to the geo-tracking, I think maybe you're referring to the genomic sequencing that we complete. And just, I suppose, as your final question, then I'll pass that over to Michael just to give the detail on what we're doing at a genomic level as part of COG UK.
Yes, thank you, Minister, and thank you for the question. Very important that we continue to monitor this virus. I mean, it's been fairly stable. It hasn't mutated much. We have 7 broad variants of the virus since it first arose in Wuhan. And the reason it hasn't mutated much is that it's already well adapted to spread between people. This variant has unfortunately arisen. It is more transmissible. Thankfully, we've no evidence to date, although the evidence is not yet robust, that it appears any more causes any more severe disease. And I think more importantly, we have no evidence at this time that it would render the vaccines any more or any less effective, I should say. We are doing more genomic sequencing than any other country in Europe. The UK has been set in place, as Minister said, a UK-wide arrangement for genomic sequencing and random sampling of isolates on an ongoing basis over the last number of months, and by comparison to other parts of Europe and indeed the Republic of Ireland, we sequence more in Northern Ireland and in the UK than anywhere else. And I think that's why it's undoubtedly the case that we have detected this variant, irrespective of where it's arisen. I think that it undoubtedly, because of the travel hub, which has been alluded to throughout this morning's committee meeting, that this variant is probably more widespread and more other countries than is actually known about at the moment, because the harder you will look for it, I think that the more you will find.
Okay, thank you. Okay, thank you, members, and thank the Minister and Chief Medical Officer. Just, Minister, if I can take you back to one point in relation to our lays, you'd said that there was no off-the-shelf model that we could use legislatively. But I suppose the committee here are routinely faced with decisions on a weekly basis in relation to travel, where we restrict or we ease travel restrictions from various places. And the most relevant example is probably the Denmark one, where we saw a new strain emerging. There was a lack of clarity about what the impact of that strain would have, and countries very quickly, and I believe very appropriately, moved to stop the travel and allow an assessment to be made of what the impact would be or how that might be managed. And then over a period of time, those restrictions were eased again. So why could that example not have been followed very, very straightforwardly in this case?
I think there's no legislation. I said we could lift straight off the shelf, Chair, because what we would have had to have done was, and then again it was using the 67 Act in regards to curtailing travel within the United Kingdom. The reference that you make is to your travel regulations under the Coronavirus Act for international travel, and those are specifically set up and curtailed and designed actually and unspecified for travel for anybody coming from without the common travel area. So we could have I suppose it was we could make adaptations to what that legislation looked like, but it would have to have been done under the auspices of the 67 Act.
Okay, but we have also seen where regions, even of countries, where at times the Greek islands were parts of were stipulated within restrictions. So are you saying that was essentially a political decision in relation to the international element of that?
No, Chair. Sorry. For us to introduce travel restrictions within the UK, we were going to have to look at utilising the 67 Act. Whereas it came to, you're talking about the Greek islands, or the decisions there are all based on the information, the data that comes forward from JBC. The legislation that's used to do that and implement that is specifically for travel outside the common travel area. So there is no current legislation that actually allows that travel ban between parts of the United Kingdom that we currently have on record or accessible here in Northern Ireland. So we'd have to start from scratch in development. We could look to other models and other pieces of legislation that are currently there to form the basis of it, but there isn't that specific.
Okay, thank you. And I suppose I would like to take the opportunity before we say good luck to yourselves for now, is to take the opportunity to reiterate the message to the public that we are in a very, very difficult situation. We're facing into a Christmas like no other, and I think we all need to realise that, and we need to take decisions based on the fact that this Christmas can't be like any other. There will be other Christmases if we protect each other, if we protect our health service, but it's incumbent on all of us. And I think we all share that same goal, despite the fact that we have differences in terms of how things are done. We all share the goal that we want to protect our population, we want to protect our health services, and we want to deal with this pandemic in the best way we possibly can. I want to thank you both just at this period of time for coming today. I think it has been a very useful session, and I think the additional time and focus has allowed us to go into more detail in a number of areas, and I think that's useful to consider going forward into the new year. But also to thank you, Minister, and the Chief Medical Officer and your team, as I said earlier, your entire leadership team, and for the work and effort you put in, and also to send out a very, very warm message of solidarity to all of our frontline staff who have been working under so much pressure for so long now. I would ask every single member of the public to consider that every time they're taking a decision, as well as considering themselves and their families. Think about how hard health staff have been working here do everything you can to do the basics, to maintain social distancing, limit your contacts right down to a bare minimum, washing hands, and all that very basic respiratory hygiene. I just want to finally wish both of you, Nollaig Hannah Dave, a very, very happy Christmas and a safe and a happy and a peaceful New Year. And I hope that the New Year will bring better things for all of us.
Chair, just in finishing, thank you for those comments. Because I have, and look, as a department, we are appreciative of the support that we get from the committee, and I think it's a healthy interaction that we have. When I look to the relationship that some other ministers have with their scrutiny committee, it's not, I think, as constructive as we have, and I thank you for it, because I think one thing that we share is that common interest of support for our health service, the health family, and all the workers in it. And I think if we can keep working together on that issue, the opportunities that the relationship that we have, I think only continues to strengthen. And I thank you, Chair, and your other members for the continued messaging that we put out in regards to the regulations. They're not easy. They're not easy to bring, and I know they haven't been easy to scrutinise. But we've seen back at the start of the year the real benefits that they actually brought. So, we can do this again. We can do it again together. So, Chair, thank you very much again for giving us the opportunity to come today. And can I wish all the committee and your families as well a happy Christmas and a new year. And I think, Chair, we're down to come back again. I think it's your second meeting in January, because not only are these engagements useful for us, I think it's also useful to get that general message out to the people who listen and interact with these committees as well, to know exactly what is going on and the questions that are being asked. So again, Chair, thank you for your commitment and happy Christmas.
Okay, thank you for that. And Chief Medical Officer, do you want to say anything there before we?
Well, firstly, to thank you for the opportunity to come along and answer questions today. Can I reiterate your comments, Chair? Please think carefully. We are at the most fragile time of this pandemic. Decisions that you make today, tomorrow, this week and next will make a fundamental difference. Do the right thing, you will save lives, and do the right thing, you will prevent our health service coming under extraordinary pressures in the weeks ahead.
Okay, thank you, Michael, and thank you, Minister, and wish you and your families both a happy Christmas. And Almore, agus Slán, agus Chiefy Mwij, Shiv, we will see you again in due course. Thank you, Minister, and thank you, Michael. Okay, yeah, go ahead.
Chair, no, I want to put on record thanks for you chairing that particular meeting. I think that is probably the most productive meeting with a CMO and Minister that I've been a part of. I didn't feel rushed. I felt that members, I learnt as much from other members' questioning as I did from my own, and I think it is a model to go forward on. And I think the number of participants in relation to just the CMO and the Minister, with one taking the lead, and if members wanted to further deviate to the other, they could. But certainly, given the gravity of the situation that we find ourselves in, it is but only right that we give this due scrutiny. We all will not agree on the approach. Certainly there's plenty of questions to ask, but being given the opportunity to ask them at the committee in a way such as that, I think was befitting of the scrutiny role that we should be playing. So I would like to put on thanks to you for taking into consideration that additional meeting and the way in which it was conducted.
Yeah, and I think myself and the clerk have at every meeting requested that hour and a half, and I think we have understood that there has been huge pressure on, and in recognition of that, we have done our best in terms of. But I do think that is a useful lesson for the future in terms of how we function in the new year and apply that scrutiny and that advice and role that we have to apply. So thank you for that, members. I'm going to move on then to correspondence. Can I refer members to correspondence at tab 5 of your pack and the correspondence memo at tab 5.1. Have members any comments or proposals on any of the correspondence contained? No, nothing then. So members therefore content with the actions proposed on the correspondence memo. Are we agreed? Agreed. Thank you. Any other business, members? Yeah, Pam?
Just to say, we're technically in recess, so I want to say just a huge thank you to Eilish, the clerk, and to all the staff who have facilitated this today, because we know that this year has been very challenging for everybody, and that includes our staff, and there's been very little time off for any of them, so we really do appreciate all the fantastic work that goes on. There's an incredible amount of work, as we all know, goes on in the background in terms of making these meetings happen, organising them, organising the witnesses to come, and also a huge amount of work has gone into our inquiry into COVID in the care homes. So I just want to put on record our thanks to all of the staff and wish them a very happy Christmas and safe New Year.
Yeah. Alan?
Sure, I'd like to be associated with the Roads remarks. Thank you.
Okay. Thank you. Yes, and I would like to absolutely endorse them. I think there has been a tremendous amount of work done by the staff here in very, very difficult circumstances, very late minute changes, heavy agendas, a lot of stakeholders to contact, and everything being done under pressure. And I would like to absolutely thank every member of the staff. I'd also like to give a very special thanks to the clerk, who has guided and mentored and been available at all times, and I have to say that has been hugely helpful, and just the professionalism and the support that the entire team has brought to this effort, I think, has been really tremendous. And I want to wish all of the committee staff a very happy, peaceful and safe Christmas. And members, I would also like to thank each and every one of you. We have seen, I think, virtually full attendance at nearly every meeting. We have seen interested engagement. We've seen members who know what they're seeking to find out and who are seeking to be constructive. And I think that has shone through a very dark and difficult period. So I want to thank each and every one of you, and to wish each and every one of you Nollaig Honna Díobh a very, very happy, peaceful, safe Christmas for you and your families. I sincerely hope that you all get some rest over this period of time, and I know we're all kind of managing almost on a 24/7 basis at times the issues rightly that our constituents and sectors are bringing to us, and we'll I'm sure continue to do that as best we can, but everyone does need some rest at times, and I'm conscious you're right, Pam, we are in recess. We have done this now on Easter, on summer, we have met throughout recess, and I think the situation demanded that, and I think we have risen to that challenge as best we could. So I'd like to thank you all for your cooperation in relation to that.
Thank you, Chair.
So members, moving on then to the date, time and place of next meeting. Our next scheduled meeting, members, and I just do want to be clear, our next scheduled meeting was on Thursday, 14th of January in the Senate chamber, when we'll be briefed by the Minister and Chief Scientific Advisor. That time is yet to be confirmed, but given the situation, that's our next scheduled meeting, and hopefully when we will next see each other again. But if anything arises in the meantime, if members are content to leave it to the call of the Chair, if something arises unforeseen, that we can facilitate that if necessary. So, Nollaig Honna Díobh, thank you all very much, and happy Christmas.
This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland